The challenge of dealing with an emergency.
People rely on your ability to recognize and deal with life-threatening situations. They trust you to be able to perform CPR. They count on you to know how to use an automated external defibrillator and how to help a person who is choking. The good news is, that's exactly what this course plans on teaching you today. Hello, and welcome to the American Heart Association's Basic Life Support for Healthcare Providers course. Today, you're going to learn how to perform 1 and 2 rescuer CPR on an adult, child, and infant, use of an AED, use of airway devices such as a bag mask, and how to assist a person that is choking. CPR should be started immediately, without delay, to be most effective. Good quality CPR gives victims of cardiac arrest the best chance of survival. The critical concepts you should learn from this course are pushing hard and fast, compressing at the rate of 100 compressions per minute, allowing full chest recoil after each compression, minimizing interruptions in chest compressions, keeping interruptions to 10 seconds or less, and avoiding hyperventilation. With the help of your instructor, you'll actually practice right along with scenes in this video, learning the critical skills necessary to respond to emergencies. For training purposes in this video, however, you won't see the participants always using personal protective equipment, like gloves. It may seem obvious how important this information is, but don't take my word for it. Take his.
My wife was scheduled for gallbladder surgery, and I had just arrived at the hospital. Emotionally, I was very stressed. We've been married for 35 years, and I couldn't imagine anything happening to her. I didn't expect to be the one in trouble. Certainly didn't expect to come so close to dying that day.
Oh, no, partner. The bet was for a week's worth of lunches, not for a day.
A week? Come on, Sally. Your team only won by 1 run. Look.
Sir, are you okay? Sir, can you hear me? Mike, he's not responding.
I'll get help from the ED.
One, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19.
James's life is literally in Sally's and Mike's hands. Emergencies like this can happen anytime, but quick action can save someone's life. Right now, your instructor will pause the video to allow you to get into position to practice with the mannequins and learn the skills of CPR. Early CPR keeps oxygen and blood flowing to the heart and brain until other medical care can be given. The most important part of CPR is giving effective chest compressions, pushing hard and fast, and making sure the chest fully recoils. You'll learn other steps to go with this soon, but for now, we'll just be doing compressions. You see, we want to focus on the most important parts of CPR first, then we'll put them all together later in the correct order, so pay close attention. To begin, we'll be starting with adult CPR. Then we'll discuss any differences in technique for children. Follow along with the video footage as you practice, and switch students on the mannequins when the video instructs you to. To give effective compressions, kneel at the victim's side and make sure that he or she is lying on their back on a firm, flat surface. First, quickly move or remove clothes from the front of the chest that will get in the way of doing compressions and using an AED. Put the heel of one hand on the center of the bare chest, between the nipples. Then, put the other hand on top of the second. Make sure the long axis of the heel of your hand is on the breastbone to reduce the chance for rib fracture. Your shoulders should be right over your hands, and your elbows should be straight. Either extend or interlace your fingers to keep them off the victim's chest. You're going to push straight down on the victim's chest, ensuring that you're pushing directly on the breastbone. For adults and children that have reached puberty, you'll press down 1.5 to 2 inches. After each compression, let the chest come back to its normal position, ensuring full chest recoil. This allows blood to flow into the chest and heart. Perform 3 sets of 30 compressions at the rate of 100 per minute, counting out loud as you press. Are you ready? Here we go.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Now we're going to learn another part of CPR, opening the airway and breathing. As a healthcare provider, you'll be expected to use a barrier when giving breaths. However, be aware that if it's necessary to give breaths without a barrier, mouth to mouth that is, you can use the following procedure effectively without one. To open the airway, we use a technique called the head tilt chin lift. First, place one hand on the victim's forehead and apply firm, backward pressure with the palm to tilt the head back. Place the fingers of the other hand under the bony part of the lower jaw near the chin. Lift the jaw upward to bring the chin forward. This maneuver will lift the victim's tongue, allowing for breathing and relieving a possible airway obstruction. However, do not use your thumb to lift the chin. Also, do not press deeply into the soft tissue under the chin because this might block the airway. While you hold the airway open and pinch the nose shut, you're going to give 2 breaths. For each breath, you will take a normal breath, put your mouth over the victim's mouth, and blow. Each breath should be delivered over 1 second. Make sure the chest rises with each breath. Actually seeing the chest rise with each breath is the best way to ensure your breaths are effective. If you find that you're unable to ventilate the victim, reposition the victim's head by performing a head tilt chin lift again and retry giving a breath. If this doesn't work,
1,
proceed
2,
to CPR,
3, 4,
starting with chest
5,
compression.
6, 7.
Okay, here's your chance to open a victim's airway and give breaths. You should already be in position to practice. Once again, practice along with the video and make sure you see the chest actually rise with each breath you give. We'll practice 5 sets of 2 breaths together. First, place one hand on the victim's forehead and apply firm backward pressure with the palm to tilt the head back. Place the fingers of the other hand under the bony part of the lower jaw near the chin. Lift the jaw upward to bring the chin forward. While you hold the airway open and pinch the nose shut, take a normal breath, put your mouth over the victim's mouth, and give 2 breaths, each lasting 1 second. Make sure the chest rises with each breath. Give 2 breaths. Watch for chest rise. Give 2 breaths. Give 2 breaths. Give 2 breaths. Okay, now you know the basics of mouth-to-mouth breathing. It's a quick, effective way of providing oxygen to a victim. However, as mentioned previously, you and Sally are healthcare professionals. As such, you're required to use standard precautions whenever there is exposure to blood or other bodily fluids, like saliva. These precautions include using barrier devices, such as a face mask. A face mask usually has a one-way valve and diverts exhaled air away from the rescuer. There are different sizes for adults, children, and infants, so make sure you're using the appropriate size for a victim. The mask should only cover the victim's mouth and nose. It should not extend over the victim's eyes. Okay, here's your chance to try mouth-to-mask breathing. You should already be in position to practice. Once again, practice along with the video and make sure you see the chest actually rise with each breath you give. We'll practice 5 sets of 2 breaths together. You ready? Here we go. Kneeling next to the victim, place the mask on the victim's face, using the bridge of the nose as a guide for correct position. Seal the mask by placing the index finger and thumb of your hand closest to the top of the victim's head along the border of the mask. Place the thumb of your other hand along the lower margin of the mask. Open the airway using a head tilt chin lift. Press the mask down and lift the jaw to hold the mask tightly against the face, and give 2 breaths while watching for chest rise. Each breath should be delivered over 1 second. Give 2 breaths. Give 2 breaths. Give 2 breaths. Give 2 breaths. Okay, you know how to do compressions and give breaths. Let's practice them together. We're going to do 3 cycles of 30 compressions combined with 2 breaths using mouth-to-mask breathing. Remember to press down 1.5 to 2 inches when you compress and allow full chest recoil. You should already be in position, so practice along now as we combine both steps into one sequence. You ready? Here we go.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. One, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. One, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Okay, we've covered almost all of the skills of CPR. Now let's add the assessment steps that lead up to compressions and breathing. First of all, you'll want to assess the victim's responsiveness. This starts with tapping the victim and shouting to get their attention.
Hey, are you okay? Sir, can you hear me? Mike, he's not responding.
I'll get help from the ED.
If the victim doesn't respond, activate the emergency response system if you are not EMS and get an AED. If you are in an out-of-hospital setting, you'll call either 911 or your local emergency response number. If you are in an in-hospital setting, you may generally call a code and get a crash card.
Hey, are you okay? Sir, can you hear me? You, activate the emergency response system and get an AED.
Open the victim's airway and assess the victim by looking, listening, and feeling for adequate breathing. If the victim is not breathing adequately, give 2 breaths. Then, check the victim's pulse. Maintain a head tilt with one hand and locate the trachea, using 2 or 3 fingers of the other hand. Slide these fingers into the groove between the trachea and the muscles at the side of the neck, where the carotid pulse can be felt. Make sure you check for a pulse on the side closest to you. It's important to remember that you should spend at least 5, but no more than 10 seconds trying to locate the pulse. If you do not find the pulse within 10 seconds, move on to cycles of chest compressions and breaths. Practice along with the video as we go. You ready? Here we go.
Hey, are you okay? Sir, can you hear me? You, activate the emergency response system and get an AED.
Open the victim's airway and assess the victim by looking, listening, and feeling for adequate breathing. If the victim is not breathing adequately, give 2 breaths. Then, check the victim's pulse. Maintain a head tilt with one hand and locate the trachea, using 2 or 3 fingers of the other hand. Slide these fingers into the groove between the trachea and the muscles at the side of the neck, where the carotid pulse can be felt. All right, that's all the steps of CPR for adults. Now let's take a look at a complete sequence of CPR with the initial assessment, followed by cycles of compressions and breaths. Now watch carefully, because you'll get a chance to practice all these steps together soon.
Look. Sir, are you okay? Sir, can you hear me? Mike, he's not responding.
I'll get help from the ED.
One, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. One, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11.
Congratulations. You've just learned all the steps of CPR for adults. Here's your chance to practice all the steps in order. The following scene shows an emergency. It will be up to you to take turns showing how you would respond to it. Your instructor will guide you as you practice. There are a couple of special considerations to keep in mind when performing CPR on children ages 1 through puberty.
Hey, are you okay? You, call a code and get a crash cart.
Children ages 1 through puberty will need a lower volume of air for adequate breathing during CPR. It is especially important to use enough air to visibly see the chest rise. However, if you find difficulty ventilating the victim, reopen the airway and be sure to create a good seal around the mouth or mask and reattempt the breath a couple of times, looking for chest rise. If the child does not have a pulse or the pulse is less than 60 beats per minute, provide CPR starting with chest compressions. You should perform 5 cycles, about 2 minutes, of CPR before leaving the prepubescent victim to activate the emergency response system. However, if you are alone and witness a child collapse suddenly, activate the emergency response system and get an AED immediately. Then return to the victim to provide CPR and defibrillation as needed. Also, to compress the chest of a child, compress to a depth of 1/3 to 1/2 the depth of the chest.
8, 9,
When
10,
performing compressions
11,
on smaller
12,
children,
13,
use either 1 or 2
15,
hands as
16,
needed
17,
to compress the
18,
chest
19,
1/3 to
20,
1/2 its
21,
depth.
22, 23, 24, 20. Hey, are you okay? You, call a code and get a crash cart. One, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. One, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Well, those are the variations of CPR for children 1 year of age to puberty. Now let's give you a chance to practice all the steps. The following situation depicts a one-rescuer CPR emergency involving a child. It will be up to you to demonstrate how to respond to it, and you'll use a mask for breathing. Your instructor will guide you as you practice.
I think there's something wrong with my child.
Sometimes rescuers will only give breaths without chest compressions. This is called rescue breathing. Ventilation is more effective when providing rescue breathing for an unresponsive, non-breathing victim when you use a bag mask system. A bag mask device consists of a ventilation bag and a face mask. The bag may or may not contain a valve to prevent rebreathing of exhaled air. The bag mask system is the most common method of providing rescue breathing in healthcare settings and during two-rescuer CPR. It can be used with or without an oxygen source and comes in a variety of sizes. If you're using supplementary oxygen with the bag mask, the delivery method is exactly the same as without supplementary oxygen. Deliver each breath over 1 second, making sure you do not deliver the breath too quickly or forcefully. This will help reduce the chance of gastric inflation, air going into the victim's stomach instead of his or her lungs. If too much air enters the stomach, it can cause vomiting and potentially aspiration. If you're performing two-rescuer CPR, you can use the EC clamp technique to hold a mask in place. This technique requires instruction and practice. Here's your chance to do it. As before, practice along with the video. Are you ready? Here we go. First, position yourself directly above the victim's head. Place the mask on the victim's face using the bridge of the nose as a guide. Use the thumb and index finger of one hand to make a C to press around the edges of the mask. The remaining fingers of your hand should form an E to lift the angle of the jaw and open the airway. Make sure you squeeze the mask with your thumb and the heel of your hands while lifting the jaw to achieve an airtight seal. Squeeze the bag with your other hand or push it against your leg or body. If the chest doesn't rise, then you are not providing adequate breaths. Adjust the mask, reposition the head and neck, or administer a larger amount of air. With or without supplementary oxygen, give one breath every 5 to 6 seconds. Practice this now for 1 minute.
One, 2, 3, 4, 5, 6, 7.
When another
8,
rescuer is
9,
available
10,
to assist with
11,
CPR
12,
at the scene,
13,
the second
14,
rescuer
15,
should activate the
16,
emergency
17,
response
18,
system
19,
if he or she is not
21,
EMS
22,
and get an
24,
AED.
26,
Help is on the way.
28, 29, 30.
In two rescuer CPR, each rescuer has specific roles. The first rescuer performs chest compressions and counts out loud. The second rescuer maintains the open airway and gives breaths. The compression rate for two rescuer CPR is approximately 100 compressions per minute. The compression-ventilation ratio is 30:2. Compression should be paused when giving ventilations until an advanced airway is in place. When performing CPR without an AED, rescuers should switch roles every 2 minutes to prevent. This switch should take less than 5 seconds, minimizing hands-off time. Rescuers also need to assess the rescue effort. The person ventilating the victim must observe the chest compressions that are delivered, encourage the compressing rescuer to push at an adequate rate and depth, and ensure that full chest recoil occurs after each compression. Things change slightly when you perform two rescuer CPR on children who are up to the age of puberty. For these CPR guidelines, puberty is defined as chest or underarm hair on males and breast development on females. In this case, you'll use a ratio of 15 compressions to 2 ventilations.
A lot of people ask me what it was like to, to nearly die. I don't know how to describe it. I don't even know where to start.
I've always been a pretty healthy guy, you know? I've run marathons. Not like I'm a couch potato or something. I only went to my doctor's office for a routine checkup. I never imagined I could have a heart condition. I'm only 36.
Good morning, Dr. Mitchell's office.
Hi, Mr. Garner. Are you here for your checkup?
Hey, Denise. Yeah, here for the annual inspection. Sorry, I'm a little early.
Oh, that's no problem. Dr. Mitchell should be in soon, and we'll just kick the tires and check the oil for you.
See, that's the kind of service you don't get these...
Mr. Garner? Mr. Garner? Mr. Garner? Mr. Garner, can you hear me?
When someone's heart stops pumping blood, the earlier you give CPR, the better the chance for survival. But for some victims, CPR isn't the only answer. Sometimes an abnormal rhythm causes the heart to suddenly stop pumping blood. This abnormal rhythm is known as ventricular fibrillation, or VF. The most effective treatment for VF is defibrillation. The earlier defibrillation occurs, the higher the survival rate. An automated external defibrillator, or AED, is a machine that can read or analyze the heart rhythm and tell you if an electric shock is needed to stop the abnormal rhythm. There are many brands of AEDs, and the American Heart Association does not endorse any one brand. Although AEDs may differ slightly, you will use the same steps to operate all AEDs. The AED voice will guide you. First, turn on the AED. Next, place the pads included in the AED on the victim's bare chest. Then, make sure no one touches the victim and allow the AED to check the heart rhythm. The AED will then tell you when to push the shock button if a shock is needed. You should use an AED only if the victim does not respond, is not breathing, and has no pulse. You'll also need to consider some special situations before attaching the AED, which we'll discuss a little later. But right now, your instructor will explain how to operate the AED trainer you're going to use today. Afterwards, you'll get a chance to show what you've learned. When arriving at the scene of a suspected cardiac arrest, rescuers must rapidly integrate CPR with use of the AED. Basically, 3 actions must be initiated at the scene of a cardiac arrest: activating the emergency response system, CPR, and AED operation. When 2 or more rescuers are present, these can be done simultaneously. If you think someone has suffered a cardiac arrest, first, check for response.
Mr. Garner? Mr. Garner, can you hear me?
If the victim does not respond, one rescuer should activate the emergency response system and get the AED.
Pam, call 911. Barbara, get the AED stat.
While another rescuer goes to activate the emergency response system and get the AED, continue the steps of CPR. Check to see if the person is breathing adequately. If the victim isn't breathing adequately, give 2 breaths with a barrier device. Check for a pulse, and if you do not definitely feel one within 5 to 10 seconds, quickly move or remove the clothes from the front of the chest that will get in the way of providing chest compressions and apply the AED pads.
1, 2, 3, 4, 5, 6,
Provide cycles of 30 chest compressions and 2 breaths, and use the AED when it is available.
16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Keep in mind that if you are alone and find an unresponsive adult, you'll have to activate the emergency response system and get the AED. For a child victim, give 5 cycles of CPR. Then activate your emergency response system. However, if you are alone and witness a child collapse suddenly, activate the emergency response system and get an AED immediately. Then return to the victim to provide CPR and defibrillation as needed.
1, 2, 3, 4, 5, 6.
When the AED arrives, put it near the rescuer who will be operating the
11,
AED
12,
and turn it on.
13, 14.
Some AEDs turn on when you lift the cover. Others have a power button.
Apply pads to patient's bare chest.
9, 10,
Open the AED
11,
pad package
13,
and peel
14,
off the plastic backing.
17,
Press the sticky side on the victim's bare chest. Place 1 pad on the upper right side of the bare chest to the right of the breastbone. Put the other pad a few inches below the left armpit. With 2 rescuers, don't stop CPR until the AED pads are attached to the chest and you are ready to let the AED analyze the victim's heart rhythm.
Plug in pad's connector next to flashing light.
The AED is now ready to check the victim's heart rhythm. Most AEDs begin to check the rhythm as soon as the pads are attached and connected. For others, you press an Analyze button.
Analyzing heart rhythm.
9, 10, 11, clear.
If the AED finds a heart rhythm that can be treated with a shock, the AED will tell you so.
Shock advised. Stay clear of patient. Deliver shock now.
The AED will then tell you when to push the shock button.
I'm clear, you're clear. Clear. We're all clear.
When the shock is delivered, the victim's muscles will jerk. The AED will then tell you to start CPR, beginning with chest compressions.
8, 9, 10,
Begin
11,
CPR.
12, 13, 14, 15,
After 5
16,
cycles of 30
17,
compressions and 2
19,
ventilations,
20,
pause
21.
for the AED to analyze.
Analyzing heart rhythm.
If indicated, press the shock button and switch rescuer roles.
No shock advised. Begin CPR.
1, 2,
Repeat this
3,
sequence of
4,
CPR
5,
and AED
6,
use until
7,
advanced
8,
life support
9,
providers
10,
take over
11,
or the
12,
victim starts to
13,
move.
14.
So, now you know how to use an AED with 2 rescuer CPR. Here's your chance to practice. You're going to see a situation showing a 2 rescuer AED emergency. It will be up to you to demonstrate how to respond to it. You'll perform CPR until the AED arrives and rotate roles. Your instructor will guide you while you practice. The following special situations need to be considered both before and while using an AED. A victim is less than 1 year of age. The victim has a hairy chest. The victim is covered in water. The victim has an implanted pacemaker. The victim has a medication patch or other object located where the AED pads need to be placed. At this time, the American Heart Association does not recommend for or against the use of AEDs in infants less than 1 year of age. If a victim has a hairy chest, the hair may prevent the pads from sticking to the chest. The AED may give a warning. If this happens, press the pads down more firmly. If they still aren't sticking, rip the pads off forcefully, removing the chest hair. Then reapply a new set of pads to the bare skin. If your AED supply kit has a razor, you can use this to shave the area as well. If someone is lying in water, you should quickly move the victim to a dry area. If the chest is covered with water or sweat, wipe the chest before attaching the AED pads. Water on the victim's chest could divert the shock, thereby not delivering an effective shock to the victim's heart. But wipe the chest quickly, as it doesn't have to be completely dry. Some people have implanted pacemakers and/or defibrillators in the same place where you would put the AED pads. The device will look like a round or square lump, smaller than a deck of cards. If you see this lump, put the pad about an inch away. Finally, if the victim has a medicine patch in the same place where you would put the AED pad, take the patch off and wipe the chest before you put on the pad. Other AED considerations include using an AED with pediatric functions or child pads and fully automated AEDs. Rescuers in an out-of-hospital setting should provide about 5 cycles of CPR before attaching an AED to a child, unless cardiac arrest was witnessed. And while AEDs are used the same way for both adults and children, some AEDs may have features adapted for use in children ages 1 to 8. These can include pediatric pads or a pediatric key or switch. These features are designed to reduce the shock delivered for children ages 1 to 8 and should be clearly marked. Make sure you use the correct size pads when using an AED on children of these ages. If you are using child-sized pads and they overlap on a very young child, place one pad on the chest and one pad on the back. Some pads will illustrate this type of placement. If the victim is 8 years or older, be sure you are using the adult-size pads and that you do not use the child pads or the child key or switch. The smaller shock dose for children probably will not be enough for a larger child or adult. Keep in mind that neither pediatric pads nor a pediatric switch should be used for adults. Some AEDs are fully automated. If you are using a fully automated AED, you will not need to press a button for the AED to analyze or shock the victim. Once you've thought about these special situations, you're ready to use an AED. CPR is performed slightly different when a victim has an advanced airway, such as an endotracheal tube, combi tube, or laryngeal mask airway in place. 2 rescuers no longer deliver cycles of CPR. Instead, the compressing rescuer should continue chest compressions at a rate of 100 per minute, without pausing for ventilation. However, ventilation changes to 1 breath every 6 to 8 seconds, about 8 to 10 per minute, being careful to avoid hyperventilation. Also, there is no pausing to provide breaths. Compressions continue as breaths are given. The following scene in progress demonstrates the differences when performing CPR on a victim with an advanced airway in place.
9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
After 5 cycles of 2 rescuer CPR, rescuers should switch roles. All right, your instructor will now pause the video and give you a chance to practice performing 2 rescuer CPR on a victim with an advanced airway in place. With a partner, make sure you maintain the correct compression rate, 100 per minute, while ventilating with 1 breath every 6 to 8 seconds. Continue compressions without pause while giving breaths and switch roles every 2 minutes.
They said it was cardiac arrest, and that I was just very lucky that there were trained professionals nearby. They said they were just doing their job. Nonsense. They saved my life. How do you thank somebody for something like that? I don't know.
I don't know how he survived. I honestly don't. He was born 6 weeks premature, and he weighed only 4 pounds. But he was a fighter, and he hung in there. 3 months later, he was readmitted to the hospital for respiratory problems. I wasn't scared most of the time, until the day he stopped breathing.
Jesse?
Oh, come on, sweetie. I need some help here. What's happening? What's wrong? Nurse, please tell me what's wrong.
What do you need, Candace?
Go ahead and call a code and get a crash car, please.
Any emergency can seem scarier when an infant is involved. However, the principles of performing CPR on infants less than a year old are the same as they are for adults and older children, with a few slight differences. To begin, let's take things in the same order as we did for adult CPR. To perform CPR for infants under a year old, let's start with the easiest part, compressions. You'll learn other steps to go with this later in the proper order, but for now, we'll just be doing compressions. First, imagine a line between the baby's nipples. This is the intermammary line. Due to the infant's small size, you'll just put 2 fingers of one hand just below the nipple line over the lower half of the breastbone. Be careful not to press on the very bottom or tip of the breastbone. Make sure the surface under the baby is firm and that you keep the airway open with your other hand. Press the chest down about 1/3 to 1/2 the depth of the chest. After each compression, completely release the pressure on the breastbone, allowing the chest to recoil completely after each compression. Give 30 compressions in a row. Count out loud as you press. The rate is about 100 per minute. This is called the 2-finger technique, and it's the preferred technique if you're a lone rescuer.
1, 2.
Now it's your turn to practice pushing on the chest using the 2-finger technique on an infant mannequin. As we did earlier, practice along with the video. We'll do 3 sets of 30 compressions. Are you ready? Here we go. First, put 2 fingers of one hand just below the nipple line over the lower half of the breastbone. Be careful not to press on the very bottom or tip of the breastbone. Press the chest down, about 1/3 to 1/2 the depth of the chest. After each compression, completely release the pressure on the breastbone, ensuring full chest recoil. Do 30 compressions in a row at the rate of about 100 per minute, counting out loud as you press.
26, 27, 28, 29, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Okay, now let's put together the entire sequence of one rescuer's CPR for an infant. First, check for responsiveness.
Jesse? Jesse? Oh, come on, sweetie.
If the infant doesn't respond, shout for help.
I need some help here. Listen, what's happening?
If you're alone, begin the steps of CPR. If others are present, send them to activate the emergency response system while you remain with the victim to begin the steps of CPR.
What do you need, Candace?
Go ahead and call a code and get a crash cart, please.
Okay.
Then check the victim's pulse. Make sure you check for a pulse on the side closest to you. With infants, palpate a brachial pulse by gently pressing 2 or 3 fingers on the inside of the upper arm, between the elbow and shoulder. Do this for no more than 5 to 10 seconds.
2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
You've just learned how to perform infant CPR. Now let's see how well you learned it. The following scene depicts a one-rescuer infant CPR emergency. It sets up a situation, and it'll be up to you to demonstrate how to respond to it. All breathing will be done mouth to mask for these situations. Your instructor will guide you while you practice.
Help me! Sir, please help me! My baby, he's not breathing!
Okay, now let's take a look at using a bag mask device to provide rescue breaths for infants. You use the bag mask device to deliver rescue breaths to an infant the same way you would use it on an adult, except that you deliver a breath every 3 to 5 seconds in the case of infants. Also, you need to make sure you have the right size mask so it isn't too big. So, here's your chance. Practice giving an infant breaths using a bag mask device. And remember, chest rise is the most observable sign to determine the effectiveness of your rescue breaths. First, position yourself directly above the infant's head. Place the mask on the victim's face using the bridge of the nose as a guide. Use the thumb and index finger of one hand to make a C to press around the edges of the mask. The remaining fingers of your hand should form an E to lift the angle of the jaw and open the airway. Make sure you squeeze the mask with your thumb and the heel of your hands while lifting the jaw to achieve an airtight seal. Squeeze the bag with your other hand just enough to make the chest rise. Deliver each breath over 1 second. If the chest doesn't rise, then you are not providing adequate breaths. Adjust the mask, reposition the head and neck, or administer a larger amount of air. With or without supplementary oxygen, give 1 breath every 3 to 5 seconds. Each breath should be delivered over 1 second. Practice this now for 1 minute. When you have 2 rescuers doing infant CPR instead of 1, there are 2 main differences: where you position your hands and fingers for doing chest compressions and the compression-ventilation ratio. First of all, the preferred technique for giving compressions in 2 rescuer situations is called the 2 thumbs encircling hands technique. Place both thumbs side by side, just below the nipple line, over the lower half of the breastbone, ensuring that the thumbs do not compress on or near the tip of the breastbone. The thumbs may overlap in very small infants. Encircle the infant's chest and support the infant's back with the fingers of both hands. With your hands encircling the chest, use both thumbs to depress the breastbone approximately 1/3 to 1/2 the depth of the infant's chest, and use your fingers to squeeze the chest. After each compression, release the pressure on the breastbone to allow it to recoil completely. Deliver compressions in a smooth fashion at the rate of 100 per minute. With this method, you will only perform 15 compressions and then wait for the second rescuer to open the airway with a head tilt chin lift and give 2 breaths. Coordinate compressions and breaths to avoid simultaneous delivery and to make sure the chest rises adequately.
9, 10, 11, 12, 13, 14, 15.
Besides hand location and compression ventilation ratio, rescuers switch roles after every 5 cycles of CPR to prevent fatigue.
The cart's on its way.
When the second rescuer is available, have them switch and take over compressions while the first rescuer delivers breaths. When performing 2 rescuer infant CPR, you'll drop the ratio of compressions to 15 for every 2 breaths. Remember, this is only done for 2 rescuer infant or child CPR.
7, 8, 9, 10, 11, 12, 13, 14, 15.
Okay, you've just learned how to perform 2 rescuer infant CPR. Now you get a chance to practice 2 rescuer infant CPR using your practice sheets as a guide. Your instructor will watch and critique you. All breathing will be done with a bag mask for these situations.
There's something wrong with my baby.
Now let's see how well you learned to rescue infant CPR. Your instructor will evaluate each of you.
I've never been so happy to hear my baby cry, especially after almost losing him.
The nurses were right on top of things.
Everything. They were such
professionals, you know. I mean, I was just there visiting. I sure didn't expect to find myself in an emergency. And I sure didn't expect for it to happen in the cafeteria, that's for sure.
I can't believe he actually broke his leg. What was he thinking trying to pop a wheelie?
Well, that's what he gets for trying to show off to Andrea Wilson. I'm just glad he had his helmet on.
No kidding. When that kid gets any uglier, there's no way she's gonna date him. You all right, dude? Hey?
I think he's choking. Tom, somebody help. Hey, pal, are you choking?
All right, just relax.
Yeah. Tom.
A person is choking when food or other items block a person's airway. This can be a serious, life-threatening situation. In severe airway obstructions for adults and children over 1 year of age, the victim usually will have signs of poor air exchange and breathing difficulty, such as a silent cough, cyanosis, and an inability to speak or breathe. The adult or older child may clutch the neck with both hands, making the universal choking sign. This is a signal to ask if the victim is choking.
Hey, pal, are you choking?
If the victim nods that he or she is choking and cannot talk, you must act.
Okay, relax. We're going to help you.
In a standing or kneeling victim, you'll perform what's called an abdominal thrust, or the Heimlich maneuver. Stand or kneel behind the victim and place your arms around the victim's waist. With one hand, locate the navel. Then make a fist with the other hand. Place the thumb side of your fist against the victim's abdomen in the midline, slightly above the navel and well below the tip of the breastbone. Grasp your fist with your other hand and press your fist into the victim's abdomen with a quick upward thrust. Repeat thrusts until the object is expelled from the airway or the victim becomes unresponsive. If the victim is too large for you to wrap your arms around the waist, pregnant or overweight for example, wrap your arms around the victim's chest and do chest thrusts instead of abdominal thrusts. Okay, now it's your turn to practice. With a partner or a mannequin, practice the correct hand placement for performing an abdominal thrust, or what's called the Heimlich maneuver. Afterwards, switch roles and do it again. If you're working with a mannequin, you can practice actually give thrusts. However, do not, I repeat, do not actually perform thrusts on a live partner. This is just a practice session, and performing actual thrusts could injure someone. Okay then, here we go.
Hey?
I think he's choking.
If your attempts to relieve choking in an adult or child are unsuccessful, or the victim becomes unresponsive, send someone to activate the emergency response system if you are not EMS and get an AED.
You, call a code now.
Hurry.
Perform CPR, with one exception. Each time you open the airway to give rescue breaths, look for the obstructing object in the back of the throat. If you see an object, carefully remove it, but do not perform a blind finger sweep. Choking is also a fairly common emergency among infants. The steps to relieving choking in an infant are quite different than those for older children and adults. So practice along with the video as we go through the following steps. If you find an infant choking and they are responsive, first, sit or kneel with the infant in your lap. Hold the infant prone, face down, with the head slightly lower than the chest, resting on your forearm. Support the head and jaw with your hand. Avoid compressing the soft tissues of the infant's throat. Rest your forearm on your thigh to provide support. Deliver up to 5 back slaps, forcefully in the middle of the back between the infant's shoulder blades, using the heel of your hand. Deliver each slap with sufficient force to attempt to dislodge the foreign body. Then place your free hand on the infant's back, supporting the head with the palm of your hand. This will cradle the infant between your 2 forearms as you turn the infant over while carefully supporting the head and neck. Keep the infant's head lower than its trunk, and deliver up to 5 quick downward chest thrusts the same way you perform compressions, just below the nipple line over the lower half of the breastbone. Do this at the rate of about 1 per second. Repeat the sequence of 5 back slaps and 5 chest thrusts until the object is removed or the infant becomes unresponsive. If an infant suffering from choking becomes unresponsive, shout for help. Then, lay the infant on a hard, flat surface. Perform CPR with one exception. Each time you open the airway to give rescue breaths, look for the obstructing object in the back of the throat. If you see an object, carefully remove it, but do not perform a blind finger sweep. If you are alone, after about 2 minutes or 5 cycles of CPR, activate the emergency response system if you are not EMS.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15.
When an infant loses consciousness, the object may no longer completely block the airway. In addition, chest compressions may help move the object so you can remove it. You'll need to be careful performing finger sweeps as the object may become lodged further back in the airway. Never perform a blind finger sweep. You only want to sweep for an object if you can see it. Now, in addition to all the things you've learned and practiced today, there are a few special situations to take into consideration. When giving CPR, first, make sure the scene is safe for you and the victim. In the case of trauma, only move a victim if it is necessary for safety. You may also have to move a victim if it's necessary in order for you to perform CPR effectively. Although the risk of getting an infectious disease during CPR is very low, the Occupational Safety and Health Administration requires that healthcare workers use standard precautions when there is any exposure to blood or bodily fluids. This includes using barrier devices, gloves, goggles, face masks, and gowns. If a third rescuer is available during the resuscitation of an unresponsive victim, they can apply cricoid pressure to help prevent gastric inflation. To do this, as the first and second rescuers continue CPR, locate the Adam's apple or thyroid cartilage with your index finger. Slide your index finger to the base of the thyroid cartilage and palpate the prominent horizontal ring below the thyroid cartilage. This is the cricoid cartilage. Using the tips of your thumb and index finger, apply firm backward pressure to this cartilage. This will help prevent vomiting, aspiration, and pneumonia. Whenever you suspect a head, neck, or spine injury, if possible, use a jaw thrust instead of a head tilt chin lift. This opens the airway while minimizing movement of the head and neck. Place your fingers on the angles of the jaw and lift the jaw forward. This will move the tongue away from the back of the throat and open the airway. If you use a jaw thrust to open an airway on a victim with a suspected head, neck, or spine injury, and your breaths are ineffective, use a head tilt chin lift to open the airway. In some victims, you may see occasional gasps. If the victim is not breathing adequately and is gasping, give them 2 rescue breaths. If a victim remains unresponsive but starts to breathe adequately and has a pulse, you should move the victim into the recovery position. Do this by placing the victim on his or her side, supporting his or her head and neck while doing so. This should only be done if you don't suspect a head, neck, or spine injury. Okay, now that you know the details of basic life support for healthcare providers, let's take a look at how they fit into the big picture. The adult chain of survival offers a useful metaphor to summarize this. It provides the best approach to the treatment of persons in cardiac arrest or at high risk for cardiac arrest. The 4 links in the adult chain of survival are early access, early CPR, early defibrillation, and early advanced care. Early access includes recognizing warning signs and calling emergency medical services or activating the emergency response system. CPR is most effective when it starts immediately after a victim's collapse.
2, 3, 4, 5.
Early defibrillation is another link in the chain of survival that improves survival rates. And early advanced care provides the equipment and skills necessary to stabilize the victim for transport. The pediatric chain of survival is similar to the adult chain, with a few differences. Since the recovery rate for many pediatric cardiac emergencies is poor, the first link in the pediatric chain of survival is prevention. Taking care to create a safe environment for children is the best step in dealing with possible emergencies. This is followed by early CPR, early access, and early advanced care. And although this chain is presented as a sequence, it's always possible to accomplish more than one task at once with multiple rescuers. The adult and pediatric chains of survival are designed to help you react effectively to the 4 common life-threatening emergencies: cardiac arrest, choking, stroke, and heart attack. In cardiac arrest, blood circulation ceases and a victim's vital organs will not get enough oxygen. This is often caused by an abnormal heart rhythm called ventricular fibrillation. This causes the heart to quiver and not deliver adequate blood supply. You've already learned that early recognition is key to successfully helping a choking victim. Since choking can seem similar to other emergencies that cause respiratory distress, it's important to remember and look for specific signs. Remember, signs of choking include poor air exchange, high-pitched noise while inhaling, respiratory difficulty, cyanosis, inability to speak, breathe, cough effectively, or move air. A victim demonstrating any of these signs, or the universal choking sign, will need immediate aid to relieve a severe airway obstruction. Without help, the victim will not be able to get enough oxygen to survive, and death will soon follow. When a victim's brain doesn't receive enough blood and oxygen, either because of a blood clot or bleeding into the brain, a stroke occurs. Recognizing the signs and symptoms of stroke is critical to early intervention, especially since these signs are often subtle. They include sudden weakness or numbness of the face, arm, or leg, especially on one side of the body, sudden confusion, trouble speaking or understanding, sudden trouble seeing in one or both eyes, sudden trouble walking, dizziness, loss of balance or coordination, and sudden severe headache with no known cause. Activate the emergency response system as soon as you see a person displaying these signs and symptoms. A heart attack occurs when an area of the heart is deprived of blood and oxygen, and the muscle begins to die, causing chest discomfort or pain, among other symptoms. This is often the result of a sudden, severe, or complete blocking of a coronary artery. The classic symptoms associated with acute coronary syndromes, including heart attacks, are chest discomfort. But symptoms may also include discomfort in other areas of the upper body, shortness of breath, sweating, nausea, and lightheadedness. The symptoms of a heart attack are characteristically more intense than angina and last greater than 15 minutes. Atypical symptoms or unusual presentations of heart attack are more common in elderly, female, and diabetic patients. Your student manual and CD describe many of the ways a patient may exhibit signs of a heart attack. The discomfort a heart attack victim feels may not be severe. He or she may only complain of related symptoms, so be aware that early recognition is key to effective treatment. Activate the emergency response system as soon as you see a person displaying these signs and symptoms. Well, this concludes the American Heart Association's Basic Life Support for Healthcare Providers course. As a healthcare professional, there are people counting on you every day to be prepared when an emergency strikes. They count on you to know how to give CPR and use an AED. And they expect you to be able to care for victims of all ages. But of course, I'm sure you realize that by now. After all, that's what you do.
If they hadn't been there,
I wouldn't be here today. I feel like I have a new lease on life. A second chance. All the things I won't miss.
All the memories. All because somebody did their job. All because Somebody was my hero.
Now you get to show how well you've learned one rescuer CPR for adults and children. Your instructor will evaluate each of you.